The following information is provided by the National Comprehensive Cancer Network, known as NCCN. Overview of endocrine therapy for metastatic breast cancer. Endocrine therapy blocks estrogen and progesterone to treat hormone receptor-positive, HR-positive, metastatic breast cancer. To understand how this therapy works, it's important to know the endocrine system is made up of organs and tissues that produce hormones, which are natural chemicals released into the bloodstream. Hormones attach to hormone receptors. These are proteins found inside or on the surface of a cell. What causes breast cancer to grow? One answer is hormones. And endocrine therapy will stop your body from making hormones or change what hormones do in your body. This can slow tumor growth or shrink the tumor for a period of time. Did you know that most breast cancers are hormone receptor positive? In hormone receptor positive, HR positive, metastatic breast cancer, estrogen and/or progesterone hormone receptors are found in at least 1 out of every 100 cancer cells. There are 2 types of hormone receptor positive cancer cells: estrogen receptor positive, ER positive, and progesterone receptor positive, PR positive. This means that breast cancer cells are considered hormone receptor positive if an increased number of estrogen receptors or progesterone receptors, or both, are found. Sometimes, endocrine therapy is called hormone therapy, but it's not the same as the hormone replacement therapy used for menopause. There are several types of endocrine therapy from which you and your doctor could choose. These methods include surgery to remove the ovaries, ovarian ablation, which stops the ovaries from making hormones, ovarian suppression, which suppresses hormone production temporarily, estrogen receptor modulators or anti-estrogens, and aromatase inhibitors. Options for endocrine therapy are partly based on if you are in premenopause or menopause before starting treatment. In menopause, the ovaries permanently stop producing hormones and menstrual periods stop, and estrogen and progesterone levels will stay low. Treatments like ovarian surgery, ablation, and suppression are only for those who are premenopausal. Now let's look at each type of endocrine therapy in turn. Surgery is one possibility. The surgery, called a bilateral oophorectomy, removes both ovaries. This stops hormone production by taking away its source. Ovarian ablation uses targeted radiation therapy to permanently stop the ovaries from making hormones. Ovarian suppression, on the other hand, means temporarily stopping the ovaries from producing hormones. One approach for this is a class of drugs called LHRH agonists. Another method that might be used are GnRH agonists. Both types of drugs work to suppress the production of ovarian hormones and are used in premenopausal women only. Anti-estrogens are used to prevent hormones from binding to and activating the hormone receptors. These include selective estrogen receptor modulators, or SERMs, such as tamoxifen, which bind to the estrogen receptor and block estrogen from the receptor, and selective estrogen receptor degraders, or SERDs, which bind to and destroy estrogen receptors. Aromatase inhibitors, or AIs, stop a type of hormone called androgen from changing into estrogen by interfering with an enzyme called aromatase. They come in both steroidal and non-steroidal forms and do not affect estrogen made by the ovaries. For AIs to be used, 1, you must be in menopause, or 2, your ovarian estrogen production must be eliminated or suppressed. Other treatments might be added to endocrine therapy, such as a CDK4/6 inhibitor. Cyclin-dependent kinase, CDK, is a cell protein that helps cells grow and divide. For hormone receptor positive, HR positive, HER2 negative cancer, taking a CDK4/6 inhibitor with endocrine therapy may help control cancer longer. With all CDK4/6 regimens, those who are premenopausal must also receive ovarian ablation or suppression. You can find more information on endocrine therapy and other treatments for metastatic breast cancer in this book, written specifically for patients and caregivers, entitled NCCN Guidelines for Patients, Metastatic Breast Cancer. Thank you for watching this video. We hope this has helped you become more familiar with the types of endocrine therapy that may be used to treat your hormone receptor-positive breast cancer, and that you have a greater understanding of how they work. For more information and to access the full library of NCCN Guidelines for Patients online, please visit nccn.org/patient guidelines or download the mobile app at nccn.org/apps. Please note, NCCN Guidelines for Patients are not intended to be a substitute for medical advice. Talk with your care team to determine the right course of treatment for you.